Hey folks, welcome back to another wilderness slash climbing knowledge video slash medicine video. So today I want to talk about first aid and specifically first aid kits, but I really want to emphasize this video is less about the actual gear you bring and more about the mindset you have and the gear that is associated with your mindset. Okay? So when we think first aid, we should think the first thing you do to help somebody when they're hurt. Okay? Those are also known as life-saving interventions. A little bit more of a mouthful, but it's the same thing. What action or intervention can you do to save their life or limb? Now, this can be broken down into roughly 4 categories of treatment: airway, breathing, circulation, disability. Disability is related to damages to your central nervous system. E for environment, so this might be hypothermia, hyperthermia, and G for glucose. Especially relevant for diabetics, but also relevant for normal people as well. So when you think about first aid and when you think about a first aid kit, I want you to think about these 6 interventions and how you can build a kit around action you take for each area, okay? Because these 6 categories are how people either live or die in the wilderness. Okay? So we're going to start with A, airway. Now, when it comes to airway, what we're really looking for is there anything obstructing the flow of air from the external environment into their lungs? So through their mouth or nose, into their trachea, I guess over their epiglottis, into their trachea, down to their bronchi, down to the bronchioles, and then into the alveoli where the gas exchange occurs. Okay? So you don't need to know that anatomy, but you should know is something blocking air going through there. So there's a few fancy tools out there you can use. You can put in an actual airway into their mouth or through their nose. I'm not going to get into that, but you as a first responder, if you take like a CPR class, the first thing you're doing is checking the airway. Is something in there? Can you remove it? Mind you, when you're doing that, make sure you're careful not to lose your finger because they might close their mouth suddenly. So there's a few different techniques called you can kind of flip your thumb, I'm blanking on the name, but kind of propping open their jaw like that, so you're kind of opening it to look in there. And then you can use your finger or maybe like a spoon or something to shovel things out, or roll them on their side and get whatever might be blocking it. Okay. Next we have breathing. Okay. Breathing is, do you see adequate ventilation and do you feel air moving in and out of their mouth? So you're looking for chest rise, chest fall, and you also might be trying to feel warmth around their mouth or nose. Okay? Now these are things that you can learn in great detail in a CPR class. So I highly recommend taking one. They're only like 3 hours long and maybe like $50, $60. Sometimes they're free. So crucial. That is a part of your first aid kit, is your CPR training, okay, in your brain. Now we're going to move on to circulation. So now we're talking about the adequate perfusion, which means blood moving around the body, getting to the appropriate muscles, to your brain, to your lungs, to your heart, to your extremities. That's what we're looking for. Now, circulation can be impacted in a number of different ways. External bleeding is one of the more obvious ones, okay? You also might have a heart that's not pumping blood correctly. that's a circulation problem. Or maybe you have what's called a container problem, where their blood vessels are dilated, way too big, okay? And they're so dilated that blood can't move around the body. So that's what we're thinking about with circulation. So what does that look like in a first aid kit? So let me show you. So we covered A and B again, just with your head, okay, with your brain. Skills you can go acquire in a CPR class. All right. Now, ways to, before I actually show you what I use to improve circulation, you should always check their radial pulse, and you can also check their carotid pulse, okay? If you don't feel either of those, begin CPR, okay? So that's a way to think about this list, is that you should never progress to the next letter until you've done everything you can to address the current concern, okay? So if airway isn't intact, don't worry about bleeding, okay? Now, you will find some different literature, different opinions on whether C should come before A. It's kind of hard. These three are so interconnected, and you as a first responder or EMT or ski patroller, you're going to be kind of assessing the three of them in like an instant, okay? So again, those are more nuanced things that you should learn in a CPR class. I'm not going to advise on that. I really just want to talk about the first aid kit and how it ties into these items. Okay, so let's say they're talking, they're breathing okay, they have a radial pulse, but they've got blood pouring out of their leg, okay? So apply pressure. That's the first thing you should be doing. And there's this stuff called gauze that you can pack into the wound or put directly over. And again, the goal there is to stop the bleeding so you can maintain circulation, blood flow around the body. Now, let's say I decide to pack it with some of this roller gauze, okay? Stuff it in there. Still not working. It's still bleeding. I'm going to use what's called a Slishman pressure wrap. This is really similar to a tourniquet to some extent, where you're going to put the extremity, arm or leg, through this loop and cinch it down, make it as tight as possible, okay? And then you're just going to start wrapping it, okay? What I love about the Slishman pressure wrap is that compared to like a windlass tourniquet where you're rotating something, those hurt like hell, and they often need to be readjusted as the muscle is swelling or the body is adapting to this trauma that ever happened. Whereas the pressure wrap is continuously applying pressure. And this allows it to continue working as the body's changing. So throw on that tourniquet. If you can't control the bleeding with direct pressure and stuffing gauze in there, put on that tourniquet, okay? And then mark the time that you apply this. If you don't have an easy way to mark it, get Sharpie and write it on the patient or put it in your phone. Just make sure you mark that time, because that is very important for advanced providers to know when that tourniquet is applied. Okay, so we have the Slishman pressure wrap. You could get one of those Israeli combat tourniquets. Those are really helpful too. Either way, you want things that can apply pressure over an extremity and compress those blood vessels to encourage clotting and stop the bleed, okay? Now, let's say you have a bleed that is up here, or really under the armpit, you can't get to it, okay? Or in the groin. Those are called juncture bleeds, okay? They're especially worrisome because it is in an area where you cannot apply a tourniquet, and there's also quite a few arteries there, okay? So down in the quad, you have your, or kind of in your inner thigh, you have your femoral artery, and that again is something that can get poked with skis or bike handle. So if you can't put a tourniquet on there and it's splurting blood, arterial bleeding, and you've tried to pack it as much as you could, you should carry some sort of hemostatic dressing, okay? So I really just carry one dressing. Maybe I should have more. This is, again, just kind of my personal first aid kit that I take on my climbing trips and such. So I pray that this, combined with this, and more gauze pads, I should be able to get a good handle on that bleed. And if it still isn't working, just get your hand in there. Like put your hand in that wound and hold it there, okay? Because that will, again, encourage clotting. You might need to hold it for 10 minutes or 30 minutes, but just keep it on there until you can get to more advanced care. Okay. So, I will mention one thing too. I always carry non-latex gloves with me. These are awesome. I prefer to carry 2 pairs because often I am in a group setting. So if one person gets hurt, we can have multiple people helping. Scene safety is so important. Oh my God, it's everything. You as the first responder, remember it's not your emergency, it's their emergency. So make sure you are safe. Again, this is not a video on the full assessment, including scene size up, primary assessment, secondary assessment. Again, I'm trying to just think about life-saving interventions and how it ties to your first aid kit. Okay. So, we have our patient. They're breathing okay. There's nothing in their airway. We controlled their bleeding, whether that was the tourniquet or gauze or direct pressure or just a trusty old Band-Aid. Now we're going to jump up to disability, okay? Now this is where we start to consider, is their central nervous system impacted? Do they have a spinal cord injury? Or do they have a major concussion? Okay. Again, these are things when you're in the field, there isn't a whole lot you can do besides kind of assess it. Okay. So, did they have major head trauma? Are they confused? Are their pupils equal, round, and reactive to light? Can they follow your finger? Okay. Are they vomiting severely from hitting their head? Now, also a part of disability, if you suspect a spinal cord injury, whether there was a large fall or a high velocity impact into a tree or a rock fell on them like a boulder, we're starting to be worried about their spine. Okay. Now, there's a lot we can talk about for the spine, and I don't have enough time in this video to go over that in that detail. But what I want you to think about is, do they have what's called circulation, sensation, and movement in their 4 extremities? It's a really quick test to see, is something in the spine impacted? So we have nerves that run from our brain into our spinal column, and then they extend away from that spine and between each vertebrae. So those nerves control your movement, what hurts, temperature. So just check, feel their hands and ask them, can they feel that? Okay. And then say, can you move your fingers? Can you move your feet? Quickly, you can just quick check it. And then brush their fingertips and say, can you feel this? If you want to be really precise, check their pinkies. That's the furthest nerve out. So that will tell you if this is good, it's most likely good over here too. And the fingers. And then C for circulation. Again, this is kind of a part of C, but it's called CSM is the acronym you hear first responders say. Just grab their finger and check their nail bed and see if it returns from white to dark in less than 2 seconds. It should be really quick. So again, why is disability really important? Well, if it's a major head trauma, they might be internally bleeding in their brain. That can lead to a death pretty quickly. So that would be like, let's get them out of here fast. So this is really, in my opinion, most important for defining how you're going to evac that person. Okay, disability. Now we're going to jump to E, environment. Okay, so hypothermia and hyperthermia. Hypo meaning lack of heat, hyper meaning excessive heat. Those can kill people. Okay, now this is where I carry an emergency blanket. Now these blankets are really intended for keeping you warm, but they can also kind of help keep heat off of you. Okay, so in general though, if you have someone who's suffered major trauma, maybe their blood is not perfusing or circulating around their body correctly, they're going to get cold really fast. Now, that's where this is so important. It's super light. Just throw it on them, okay? If you think they are going into cardiac arrest or shock or have major head trauma, these are all traumas that impact the body's ability to regulate temperature. They're going to get cold very quickly. Just throw this on them, okay? So pretty easy consideration. And if they're not cold, don't worry about it. But again, it's part of the checklist. All right, we're almost done. G for glucose, okay? When we think about becoming hypoglycemic, this is pretty scary because this means the body has run out of energy stores and they're going to go into cardiac arrest and die if they don't have glucose. Now, when someone is hypoglycemic, when it's really severe, they're going to appear anxious and agitated and kind of have a fight or flight method because their body is actually going to do one final dump of glucose that is stored across their bones, across their body, and that will rev them up for a little bit longer, and then they're going to go unconscious. Okay, they're going to stop breathing and go into respiratory failure and cardiac arrest. So if you find someone who is unconscious and you don't know what's going on, they might be diabetic. They might just be severely hypoglycemic. Give them some sugar. There's something called glucagon paste. You can rub it on the inside of their mouth if they're unconscious, and just kind of like a goo could even work. Just kind of put it in there. Just a little bit of sugar will help. If they can talk, just give them a little bit of sugar, gushers, candy, something to keep them alert. And it's very rare that you would send them over the edge towards hyperglycemia. So even if they are extremely hyperglycemic and have too much glucose, yes, they need insulin, but a little bit of sugar is not going to kill them. But if they're hypoglycemic, meaning they lack blood sugar in their blood, that's a very precipitous decline. Okay, so sugar can save them. Okay, so that's kind of the first aid kit, right? So it's not terribly complicated. I carry I don't know where it is, a pocket knife with me. I carry lots of roller gauze, hemostatic dressing. I carry some tape. I carry the heat blanket. And I carry what are called triangular bandages. These are really nice for securing an extremity. And I carry this pressure wrap, kind of like a tourniquet. And last but not least, I carry some Advil. And so this is a combination of Ibuprofen and Tylenol. or acetaminophen. So these are both great for pain. And then I carry Benadryl for some allergies. I can't find it right now, but maybe I'm out of it. But yeah, so subtle allergy relief. Here you go. Benadryl. Perfect. I don't carry this large packet, but so those are kind of the medications. And I carry a lighter for if I need to make a fire for some reason. Now, again, the first aid kit is great. And there's going to be so many ways you can create that first aid kit. The more important thing is to think about these 6 areas and what you can do with your first aid kit and with your brain to keep them alive in these 6 areas. Okay. Now, I will highly encourage everyone to treat this video as a quick little intro to wilderness medicine. I highly encourage you to go get your woofer. Desert Mountain Medicine is where I got my woofer from. I'm also an EMT, and I welcome feedback. I might have missed some things here in this video, or perhaps misstated some of the physiology. So please give me feedback on things that I could do better with my first aid kit, or the way I describe the primary assessment. And yeah, thank you so much for watching. Now I'm going to say a quick bonus note for things to keep you extra safe. I'm going to show you. I carry a little satellite phone with me, inreach mini. I carry 2 walkie talkies. Holy smokes, these are so helpful when you're climbing or when you're skiing and you get separated between trees. Again, not direct first aid, but it can certainly help you prevent injury and also help you get help quicker. Say you've got, I've always thought about this and hopefully this never happens, but let's say you've got search and rescue coming and you notify them over your text or phone, but let's say you can't call them. You could tell them, hey, I'm on radio channel 37, and they can jump to that radio, or they could tell you to get on a certain channel, and then you can get that real-time communication. So a great thing to have with first aid. Always carry a headlamp. Make sure it's charged. Yeah, that's super helpful. And depending on the adventure or how long I think I'll be out, I'll also carry something to purify the water. These are, I think, just like iodine tablets, so it's helpful, or just a water filter. So again, those are some bonus first aid or kind of wilderness survival things you can bring with you. And yeah, I will include a list in the video description. And thank you so much for watching. If you have, again, anything you want to see or any topics you want me to go into more detail on here, please let me know. Thank you and have a great day.